It is National Nursing Week in Canada, and this year's theme is Our Nurses, Our Future. It highlights the many roles that nurses play for patients and in the community. This year, nursing organizations across the country have launched the Hey Nurse campaign on social media, the hashtag Hey Nurse campaign, to let the public express their appreciation for nurses. National Nursing Week runs from May 8th to the 14th this year, and it aims to increase awareness for the public, policymakers, and governments of the contributions that nurses make to the lives of Canadians. It runs the same week as Florence Nightingale's birthday on May 12th. Well, with us to discuss National Nursing Week in Canada is Mr. Sylvain Brosseau, President of the Canadian Nurses Association Board of Directors. Mr. Brosseau, welcome to Forum Daily.
Thank you. Good afternoon.
Now, this year's theme is Our Nurses, Our Future. So, can you tell us a little bit more about the meaning behind this theme and the message that it wants to send to Canadians?
But as you told earlier, that the campaign is aimed at the public and gives them a chance to tell a nurse or a group of nurses how much they are appreciated for their work. And we know that the population, I would say, like or love nurses, and it's the way to say to nurses, "Thank you so much for what you do each day."
And in terms of talking about the future of nurses, what does the future for Canadian nurses look like amid constraints in the healthcare sector, including staffing shortages, mental health concerns, burnout, and so much more?
But as I said earlier to another media, we never seen this level of widespread distress before, as we say, and the situation will get worse if we don't immediately face it and put solution to resolve it. And we also know that since so many, I would say since 3 years, many nurses have faced 24-hour shift and have not been able to take a day off or a break or have had their vacation being suspended in some places. And we also see in the same time nurses or who are decided to retire earlier, switching, or some of them switching to part-time employment or totally leaving their job and or the profession altogether and going to other area. And we know that it's a bigger threat to our healthcare system. Is We know that the bigger threat of our healthcare system is the health human resource crisis, as the nursing workforce crisis. And more recently, in March 2022, the House of Commons Committee on Health released its report on addressing Canada's health workforce crisis, which recognized that we are facing a serious nursing shortage across the country.
Now, in recent news yesterday, we heard from the Ontario Health Coalition on the passage of Bill 60, otherwise known as the Your Health Act. Now, this would allow more private clinics in Ontario to conduct more OHIP covered surgeries. So, we're hearing from advocates threatening legal action around this bill. The OHA has launched a referendum on Bill 60. Where does the Canadian Nurses Association stand when it comes to this and the privatization of healthcare?
But first of all, we know there is already private services across Canada, such as surgery, lab, diagnosis, imaging, dental care, long-term care, and home care, and etc. We support, CNA support a universal health system that provides equitable coverage for all Canadians. And we think that the creation of a parallel system will pull workers from an already challenging situation with a global shortage. It's if you pull workers from the public healthcare system to the private sector, you will create more, you will increase the shortage. And taxpayers' money should never be used to fund private care. That's our view. And we think that it is in best interest of patients, taxpayers, and the health system to have nurses fully employed inside the healthcare system, inside the organization.
And in terms of the shortage, earlier this year, we saw provinces attempting to poach nurses from other provinces and even other countries in order to address these shortages. And you highlighted working conditions for nurses as one of the main reasons that many are leaving their jobs. So, just about a minute left, but can you tell us a little bit more about this and what needs to be done to improve the retention of nurses?
There is so much to be done, and this is something that I will tell you it's not new. We must first of all reimagine our healthcare system, the way it operates. First of all, we must also, as we all said, initiate a safe staffing ratio based on the intensity of nursing care of the person, depending on the health issue, adding more personal support worker to support nurses, promote and ensure a healthy work environment where we're going to find it's going to be free of violence and racism. Nurses want to work in a healthy work and place and not a place that it's toxic. We must also, that we already said, provide clinical support to the novice nurse and our expert nurses. Having clinicians, nurse specialists to support nurses in all area of the healthcare system. Safer working condition and adequate mental health care program to support them who are already in burnout, who are thinking that they will be in burnout if they continue, with all the pressure that they're going through. And I would also add something that it's important: optimize and utilize the full potential of nurses' competencies and knowledge. Nurses, according to studies, are working at around 52% of nursing activities. They are doing 48% of non-nursing activities, and we must reverse that to make sure that they are working at 100% of their full scope of practice. And I will also add that we must increase the system capacity for training and educating new nurses in nursing faculty, but also invest in this area. And about the international educated nurses, we must make sure that we expedite and facilitate the recognition of international educated nurses who are already in Canada, because we do have a lot. I don't have the number in my head, but we do have a lot of international educated nurses who are already in Canada and who doesn't work. Can we assess the process, assess the request, and make sure that we ease the process? And we saw in some provinces like Nova Scotia and I think it's in Saskatchewan that they will facilitate the process, and in Ontario as well. But we must make sure that we put everything in place to support. But we must
Okay, Mr.
tackle
Brosseau.
on the retention. We must tackle on retention. It's the most important one, the retention.
All right. Clearly, a lot of work needing to be done, especially in terms of retention of nurses in our country. Mr. Brosseau, thank you again for your time today.
Thank you. Have a great evening. Bye
We'll be
bye.
right back.
Thank you.